So hey everybody, thanks for joining us. So I'm going to kind of kick off and we're going to take this sort of like virtual tour the same way that we would do it on the van. So before we dive in, I want to just lay a little bit of groundwork about homelessness in Houston and kind of what is so unique about it. So when you drive around Houston, I'm sure that you all notice the people that are living on the streets, what feels sometimes like an increase in tents and camps and people panhandling. And it can feel really unique to Houston and probably frustrating to see this in our backyard, but it's not unique to the city of Houston. It's something that all cities are struggling with all across the nation. And it's really fueled by many different factors, namely the lack of affordable housing. So I want to zoom out a little bit and talk about kind of from a national perspective. That 2019 data showed that 17 out of every 10,000 people in the United States experienced homelessness. So that's almost 500,000 people that represent a cross-section of the entire United States. And so in Texas, we made up about 4.5% of that population. It's quite high. Texas is a big state. And what we see across the country is that some of these very large cities with dense populations, of course, have the highest percentages of homelessness. Homelessness is associated with every region of our country, every type of family status, gender category, and racial and ethnic groups. But what we do see are some trends in large subpopulations throughout the United States. So one of those is individuals. 70% of the people that are experiencing homelessness across the country are singles. They're either living on their own or they're living in groups with other people, mostly male. It's highly defined by gender, and 60% of people experiencing homelessness are male. Unsheltered. So far too many people in the US are sleeping outside. About 37% of the overall homeless population are sleeping out on the streets and experiencing homelessness in a very literal sense, an unsheltered sense. So if you'll back up to that PIT data for me. So in Houston, we measure our homeless count annually in January, and it's a physical count where we look at the number of people who are staying in shelters and the number of people on the street. It's a really intense period where different agencies throughout the continuum of care, which is kind of like our collective body of people doing this homeless work, and volunteers from the community go out and we physically count people that are living in our region. And this year, you can see 2020's data all the way over on the right. And this chart is illustrating the downward trend in our PIT count data that we've had since 2011. And so what I like to highlight is that in 2011 is really when we started all coming together and working really strategically as a continuum of care. So again, that group of people under an umbrella that we call the way home. And so we strategically started making decisions about how we were addressing homelessness and how we were housing people, and a decision that we were going to end homelessness through permanent supportive housing and other permanent housing. And so this annual count includes Houston, it includes Pasadena, Harris County, Fort Bend. Houston's region is quite large. And like I said, you can see that steady decrease. There's a little bit of an uptick, right, when we had Harvey, which was to be expected. We don't know what it's going to look like yet from COVID. It's way too early to tell, but a lot of predictors are kind of pointing that we might see another uptick again, just because of the financial crisis that our country is facing. So we've managed these numbers and we've led the nation in Houston through our permanent supportive housing efforts and through our housing efforts and coordinated access efforts. All right, Tao, next one. So here's some of the overall stats from the time of 2011 to now. So we've seen a 53% decrease in overall homelessness since 2011, which is very impressive. We've seen 42% of the individuals that were experiencing homelessness were living unsheltered in the last year. And 19,000 people total since 2011 have been placed into permanent supportive housing and exited homelessness. So of course, why we're doing this webinar today is because of COVID, right? We can't have you all here in our building and out on our tour to share. And COVID has impacted the homeless system in a lot of ways. Here's just kind of like a sampling of some of the news headlines that are showing up and have been showing up over the last couple of months. So COVID's placed a lot of additional pressure on our system. And many of the clients that we serve are considered really highly vulnerable. Unhoused people are among some of the most sick individuals in our society, and they're unable to follow the CDC's most basic virus-fighting directive, which is to stay home. So staying safe in this pandemic has meant access to good information, being able to know how you can keep yourself healthy, what's really happening, how to get tested. And for people living on the streets, they don't have access to good news and good information all the time. The homeless shelters and service providers, we don't have the physical space to be able to distance and serve all of our clients safely. And so unfortunately, it has meant, some closures and some changes to service that make it a little bit harder for our clients to get their basic needs met, like food and hygiene. And the conditions of COVID are really, risky for a healthy person, but our clients are disproportionately experiencing things like lung disease, heart disease, cancer, hypertension, factors that make COVID much more deadly if contracted. And additionally, a lot of the clients that we serve are over the age of 50. And in homeless services, our clients age prematurely. So physiologically and medically, even though they're only 50 years old, their body is more like that of a 70 or 80-year-old. And so COVID is particularly dangerous to this population. So kind of considering all of this, one thing that's really important is that we consider housing as healthcare. And so the journey to get people off of the street and into housing is a really, really important one. And so today we gathered some of our partners from the Beacon and from Temenos CDC to kind of talk about this work that we do together under the Way Home, which is a group of 100 plus organizations that are all working together to do this work and move people out of homelessness. Today, we want to kind of focus on what one of these partnerships and pathways looks like, which is from the street and search serving through outreach, through the Beacon, helping to stabilize and assess and navigate individuals into housing, and then what it looks like on permanent supportive housing, the housing entity that helps keep people housed and in a safe and stable environment.